Please, Mr. Kerr.
Well, Fulton McGregor's trying to defend the indefensible. What can be said in 4 minutes? Let me try by starting to say how let down patients, their families and NHS workers feel. We put a lot of trust in the NHS, our lives and the lives of our loved ones. But dedicated doctors and nurses feel the frustrations of a system that is too often failing patients, and they feel it acutely. We've got a health board in my constituency in special measures because of a failure of leadership, accountability and culture. Actually, the lack of accountability is startling. The board has launched a host of initiatives, but we are told as elected representatives that it's too soon to say if they're working. The special measures will probably last for more than a year. And I think my constituents are fully entitled to question how well the NHS works in their area. And they are entitled to explanations for huge waiting lists and missed targets. The more waiting lists increase, the more people who have paid their taxes and put their trust in the system are being let down. And we all know it's heartbreaking to listen to their stories. And it comes down to this: a lack of capacity in the system, which is a failure of leadership by this government. Because the fact is, many people in my constituency struggle to even get an appointment at their local health centre because GP practices lists are full to bursting point. Now, I'm not saying any of this to criticise the brilliant people who work tirelessly in our NHS. For most of the NHS staff, their work is a vocation. They consistently go above and beyond, because if they didn't, the whole system would collapse. But they are being asked to do more and more, and as a result, they are seeing their mental health suffer. And we have record levels of spending in the NHS. Despite the fact the Scottish Government did not pass on £16 billion of Barnett consequentials that should have gone into the health service. But we also have record levels of vacancies and a crisis in recruitment and retention. Astonishing levels of vacancies in key roles. So what's gone wrong? In short, there has been a catastrophic failure of workforce planning. And that failure is the failure of SNP Scottish ministers and their lack of strategic planning. And they are in their 17th year in government. There can be no passing of the buck. And we have the problem of toxic workplace cultures in many places, including Forth Valley, meaning that critically important staff are leaving. Whistleblowers, time and time again, speak of bullying and intimidation. And all of this isn't happening just because of the pandemic. And nothing makes NHS workers more frustrated and angry than to hear ministers trot out those tired old lines, because this goes a long way back, further than the pandemic. It goes back to when Andrew Neil said to Nicola Sturgeon in an interview that the NHS in Scotland needed legislation to protect it from the SNP. What we are talking about in this debate is a colossal failure of government. The NHS is a complex organisation, and bringing about change is akin to turning around a fleet of tankers. But management tick-boxing has been prioritised by management over providing the service that patients expect and need. But to change culture, you need leadership. It starts at the top. Courage is needed to break that failed groupthink that currently exists in too many parts of Scotland's NHS. We need a culture which focuses on delivering the core purpose of the NHS: patient-centred care, free at the point of need. And for that to happen, I fear we need a new set of Scottish ministers who are open to that change that is badly needed.
Thank you, Mr. Kerr.